You are listening to the Horse Radio Network, part of the Equine Network family.
Welcome to this episode of the Disease Du Jour podcast on a review of equine herpesvirus with Dr. Nathan Slovis. I'm your host, Kim Brown, editor of Equine Management. The Disease Du Jour podcast is brought to you in 2023 by Merck Animal Health. Nathan Slovis, DVM, DACVIM, Certified Hyperbaric Technologist, is the director of the McGee Center at Hagyard Equine Medical Institute in Kentucky. He is a native of Annapolis, Maryland. Slovis received his Bachelor of Science degree from Bradford University, his Doctor of Veterinary Medicine from Purdue University, interned at Arizona Equine Center, and completed his residency in internal medicine at the University of California, Davis. Thank you, Dr. Slovis, for joining us today on Disease Du Jour to give us a review of equine herpesvirus.
Well, my pleasure. Thanks for having me.
Well, let's jump right in because I know this is always something on everyone's mind, and we would love to pick your brain a little on this. So let's start with the HV1. So give us just a rundown of what it is, what it causes, and what kind of your technique is or what your pattern is when you come up with a herpesvirus case.
Well, okay, so EHV1, it seems to be getting most of the publicity, it seems like, because in certain states, it's a reportable disease. It seems like all the states, but I'm sure there's some that isn't. And so that's when people get nervous. Is, oh my gosh, my horse has EHV1. Now the state's going to get involved. What do I have to do? What are the different things that we can see here? And so the big thing is, anytime I hear EHV1, people get nervous and go, oh my gosh, my horse is going to get equine herpes myeloencephalopathy, so EHM, that's a neurological form. But, we know through various studies, the problem is trying to get a good study that you can expose a horse to EHV1 and have them, like clockwork, develop a neurological disorder. It's tough to get. And, less than 10% of these horses that are affected with EHV1 are going to get neurologic, but yet, that's the first thing people think about. The second thing people think about is abortion. And the third thing, they think about respiratory aspect. But guess what? The respiratory aspect is going to cover more than 90% of these cases if you take a poll. But it's something everybody gets all excited, all up in arms, is the neurological form. So those are pretty much the three forms that you think about. And when it comes to HV1, the respiratory, it can look like any sort of respiratory. It's a virus. It can look like influenza. It can look like rhinitis, A or B in horses. Pretty much fevers, coughing, nasal discharge. And as a veterinarian, you can't distinguish it between the others. You got to do testing. And then one of the common testing nowadays, it's very accessible, is PCR. And back when I was in vet school, the big thing is to test them is nasopharyngeal, swab. Literally, a large, almost looks like a huge Q-tip that you end up sticking up into their pharynx and test. But nowadays, with the group that they showed at Davis, all you need is a nasal swab. So now it's easier. Veterinarians don't feel intimidated by these large nasopharyngeal swabs. So that's something we can easily do if you're concerned, or you see an increased number of horses having fevers, increased incidence of coughing, what have you, and you want to know what's going on, and you want to see how well your vaccine program is working. You need to test it to try to figure out what it is. And so the interesting thing about the equine herpes virus, just like in humans, it can lay latent. And we did a study, as in the University of Kentucky Diagnostic Lab, it was like 2008, 2009, I believe. They looked at broodmares coming to the diagnostic lab. And this is for necropsy, so it's kind of a biased group, but it's just routine mares. They had other issues going on. And they looked at the submandibular lymph node. And they noticed, I think they looked at 133 mares. Just over 50% of them had EHV1.
Wow.
other submandibular lymph nodes. Again, it's latent. And out of those, again, we can start talking about the different kinds of equine herpes virus. The mutant strain, they call it ORF30. There's open, ORF30, and the mutant strain. And that is, people get nervous because that can cause the neurological form. So, and ORF, it stands for open reading frame 30. That's genetic aspect. There's a change there. I'm going to get into it, but there's a change there that can make your animal more susceptible to neurological form versus abortion form. And so 18% of them had that. But come on, we said the chance of you having neurological signs is less than 10%, but yet 18% of these animals had it. So when they try to look at the statistics on that, with what they got from the diagnostic lab, they estimated 8% of the Kentucky broodmares have the ORF30 neurological strain subclinical. But we don't have 8% of our population get neurological signs of herpes.
Yeah.
So that's kind of interesting there. But when we think of herpes, and when I started thinking about, oh my gosh, do I have neurological strain or non-neurological strain? Again, we're talking about a single point mutation at ORF30. I don't really get down into the weeds whether it's neurological or non-neurological strain, because any type of AHV1 can cause neurological signs. So everybody goes, oh, well, you got neurological strain versus non-neurological strain. I don't care. If it's equine herpes virus and your animal's neurologic, well, guess what? I don't care about the strain. And that's just me. So that's a kind of an interesting concept that's come out that everybody jumped on the bandwagon for. But I think the bottom line is any strain can cause it. And just remember that, and then you try to look into this a little more and just try to look at, how do some of these animals get, CNS signs? What actually happens? And it depends on the affinity of the strain. I know we talked about that already, neurological form versus non-neurological form. So this can happen either in the uterus or the central nervous system. But what are herpes like? They infect, mononuclear cells. They say, lymphocytes, and they have a predisposition, to attach to endothelial cells. So endothelium is all your blood vessels have endothelium, and then it causes an inflammatory cascade can occur there. You get a vasculitis, then it's almost like a stroke model. Then you get a thrombosis, you get secondary ischemic injury. It's like the equine stroke, and you can have some direct infection of the neurons. They lay latent in there. You could have some direct infection, but a lot of times it's going to be the ischemic injury that can occur there. And that's what we're worried about. So the big thing is, if your animal is diagnosed with EHV1, and like say there's some other animals on the farm that have been neurologically affected, what can we do to help decrease the incidence of them developing EHM? And so there's been some other studies out there. Dr. Lutz at the Gluck Institute has shown that if you start using anti-inflammatories, you can decrease the affinity of the lymphocytes to get on the endothelial cells. So therefore, decrease the inflammation that can occur there. So that's one thing that we found. So just use of any of your non-steroidals. You can even use even your steroidals, dexamethasone, Equiox, flunixamelamine, can be used. And then there is a study that was pointing out the use of heparin to help try to decrease the hypercoagulability of these animals. Because there was another study that was done, and forgive me, I forgot exactly where the study was, but it was performed looking at animals that were exposed to EHV1, And they noticed these animals were hypercoagulable compared to their controls. However, those animals statistically were no, in regards to the statistic aspect of the hypercoagulability state wasn't significant between the two groups, the ones that were affected HV1 and stuff. But again, they did notice that they were hypercoagulable, and that was done in EVJ. And so what was the significance of that? It's still a question, but people were giving these animals heparin, and that could be unfractionated heparin or low molecular weight heparin, just regular heparin that you can get, that we make hep flush with, use of aspirin, any of these medications that can be used to help decrease the hypercoagulability of these animals. So if this animal is all of a sudden showing some mild neurological signs, sometimes put them on these these medications. Can maybe, again, there hasn't been any real in-depth study here, may help decrease the incidence of your horse developing or worsening the signs of equine herpes myeloencephalopathy. And so that's a big thing that you'll see a lot of practitioners starting to use more and more, is that they start having animals that are neurologically mild, we'll put them on heparin. It doesn't seem to do any harm. Put them on aspirin. The group in Europe, you talk to Europeans, they like to use aspirin more than heparin. These Americans tend to use more heparin than aspirin. And it seems like when you talk to people, my colleagues, they feel like they get success either way. So which means we still don't know which one's better, at the end of the day. But you'll see us, you'll hear about that, us using those medications to help mitigate the issues. And then the big question is, oh my gosh, now I got the horse next to me had neurological form of EHV1. And now my horse, I want to prevent any chance of them getting, first of all, getting equine herpes, and then second of all, getting neurological form. What can I do? And so do you vaccinate? There's a theory that these animals may be over-vaccinated, and maybe that may predispose animals to getting neurological form of herpes. And then there's some thoughts too. Do you just put them on, medications to prevent you from getting herpes? So valcyclovir or acyclovir. Usually we'll go valcyclovir. So antiviral medications. Do you do that prophylactically? I don't think there's anything wrong with that. And then do you do valcyclovir and do you do the aspirin or heparin? I don't think there's anything wrong if you want to do the aspirin. Again, anything anti-inflammatory such as Banamine, we said, to help reduce the affinity of the lymphocytes to the endothelial lining. So those are some things that some things that may be able to be done prophylactically, and of course, isolate the animals that are known to be positive for equine herpes virus. If it's type 1 or type 4 or whatever, isolate them. You don't want them in your general population. If they're positive, get them out of there. Because you want to decrease this sort of shedding. That's a big thing there too. How often do they shed, Doc? That's a big thing is that once they get exposed, when can you release them from quarantine? When can you? The race people want to know. Your show people want to know. They stay in quarantine forever. What's the big thing? Well, the big thing is with herpes virus is that they can start shedding pretty soon after exposure, within a day or so. And they can shed 7 to 14 days. Now, I know the group in Ohio, when the Finley University was exposed, they said they could shed up to 19 days.
Wow.
So yeah, and so it used to be, a lot of the regulatory people would say, guess what? You cannot be released for quarantine for at least 21 days. Doesn't matter if your animals are negative or not. We're not taking a chance. You're 21 days. And then after the 21 days, we gotta end up testing your horse to make sure they're herpes negative. And if they are, on the whole blood as well as nasal secretions, then he can be released. But nowadays, it actually started with Florida. And The state veterinarian down there, said, boy, most of the shedding is 14 days. It was rare that you hear about these 19 to 21 days. Maybe we're overdoing it. We're losing money for our industry in regards to not only horse racing, but, sport horse, what have you, whatever discipline you're in. Maybe we're just being overly cautious. We've learned a lot over these years. I'm going to do 14 days. And the state of Kentucky at that time said, hey, well, we're going to stay at 21 days until, let's watch what Florida does. And Florida had no issues for several years. So now Kentucky's adopted that several years ago. That now if your animal is positive, here's the scenario. If your animal is positive, it gets quarantined. And then everybody else, and I'm talking about, specifically the neurological aspect. If you got a positive neurological patient, what they'll end up doing is having to isolate that animal either to another aspect of the farm or into a referral hospital. And then they'll test every animal in that facility that may have been exposed. That could be 2 animals, that could be 20, it could be 30. And if they're negative, then they can hang tight there and they watch temperatures. Because these animals, before they become neurologic, they're going to have a fever. Now, and so, I rarely get an animal that's neurologic does not have a fever. So just remember that. And then if these animals, they'll watch temperatures. And if you don't have any sort of fevers over a 14-day period, again, every state has a different regulation. But, after 14 days, then you can get retested and you can end up, and if you're negative, you can get out of quarantine. And then some veterinarians will even go that you have permission to work on a track if you have tested negative and your horse does not have fevers. Then they can they set on the racetrack, for instance, they'll set a certain time that these horses can go onto the track. That's usually after everybody else is done. You can't use a pony horse. You can't have outriders. Outriders are there for safety, but you can't ask the outrider to help you, help you try to get to the starting gate. They're going to let you really work the starting gates. And these are different ways that you can help, keep the horses active, but yet not put animals at risk. And so that's some of the things you can do here. A big thing is with abortions. Like say we got equine herpesvirus. No, we talked about the neurological form. We talked about treatment. I'm not going to go too in depth on the treatment aspect, but I gave you sort of to whet your palate of some of the things we do here.
Today's Disease Du Jour podcast is brought to you by Banamine, flunixin meglumine injection from Merck Animal Health. The pioneer NSAID for horses in the U.S., Banamine goes to work quickly to alleviate pain and inflammation from musculoskeletal disorders and visceral pain from colic to horses in your care. Don't get caught on call without Banamine. Find out more at mercanimalhealthusa.com. Do not use Banamine in horses intended for human consumption. The effect of Banamine paste on pregnancy has not been determined. See product label for complete safety information.
Now, the abortion one is, what do you do for those? What we recommend here is if you have an abortion, then we'll end up vaccinating with one of the, EHV1 abortion vaccines, because usually they have a higher antigenic load in their vaccine compared to the vaccines that may have 4 or 5 different products in there. These are specifically made to prevent abortion in mares against EHV1, and they have a higher antigenic load. So we'll tend to revaccinate the animals if there's an abortion on the farm known to be equine herpes. We'll end up, if we have a luxury, whatever paddock they may have aborted in, because a lot of it, the equine herpes virus, one is going to be in the placenta and in the amniotic allantoid fluid. And if these animals, usually when they abort, what happens? All the mares, gather around, start sniffing, licking the placenta. They can be exposed. So ideally, you like to quarantine a paddock, but majority of the time, you don't have other paddocks to put these mares in, so you just kind of keep them in their little paddock. You make sure you don't try to play musical chairs, so to speak, with stalls, paddocks. Continue them exposed. The bad thing is, you may not know for weeks later, because if they're affected, you can ultrasound them. I've tried to ultrasound them, look at biophysical profiles. you can tell which ones you're going to abort and not. So one thing is, when increasing the vaccination, we'll put them on valcyclovir, depending on the value of the fetus and the mare. So we'll do a preventative, and that may be up to 2 weeks. Now, there's been no studies that says that it will penetrate into that uterus and into the fetus, but it could help. That's probably the best option you got. And then there's some groups that will end up giving these animals a lysine, which is just a product you can get over the counter. A lot of different companies may have it, and it's just interfere with replication of the virus. And that's up for debate. There hasn't been really any really good studies on that, but it has been shown that lysine can affect the replication. And there's all different doses out there. For instance, the dose that I tend to use when you're talking about lysine, you're looking at about 12 grams orally once a day. Some of the reports that are out there. And again, it's over the counter. It does no harm. So does it help? I'd like to see more studies on that, but that's something else you can end up doing for that. And again, then the question is, well, how long should I separate my mare that just aborted?
Yeah.
And that's the big debate. Usually mares' uteruses involute within 7 days. Hence that's why you can do full heat breeding on these mares. So usually I tell people for at least 2 weeks, let the uterus involute as long as she's not dirty. Usually the vet's going to be flush them sometimes after these abortions because we have other issues that may be going on with these mares. Again, the vet decides. I say every bit of 2 weeks, and what I do recommend is that they can also test the mare. It's interesting because some of these mares, we've had abortions. I think, well, they were exposed a while ago. They're not still shedding. Well, you test them, and some of these mares should be still shedding.
Wow.
So we've tested them, and I've gone to abortion outbreaks, and I've tested them, and I'll test the animal that did abort, and then I'll test all of our cohorts, and then I try to divide them up into separate groups if I can, because some of these animals may be shedding. And so that's something else that can be utilized to determine when they can be out of quarantine. Wait until that uterus involutes. And then at the same time, if the client can afford it, test them and get a nasal swab. And usually, as I said, what do we say about shedding? We talked about before for 14 days. That's why we say 2 weeks quarantine. But it doesn't hurt to test them if you want, if you wish, and it's not a bad idea. Just got a big breeding farm.
Yeah.
So that's pretty much. Those are the alpha herpes. I guess I never mentioned that.
Yeah.
But when you think of alpha herpes, it's type 1 and type 4.
Okay. And let's go that's a great segue because there are some other herpes viruses that horses get. They're not as common, and the gamma herpes viruses. So, and let's maybe just very quickly walk through them. That's EHV 2 and 5, right?
Correct. Yep. So when you think about those, you think of 2 and 5, and they're interesting in their own right. When you think about the gamma herpes, but it's interesting. Donkeys can get exposed to different herpes virus. They have their own alpha and gamma herpes virus, and then there's alpha herpes viruses of zebras and gazelles, and that's EHV9. Because when I first went to vet school, they said, there's only 9 types herpes viruses known to infect horses. But now there's 12. We've isolated some more herpes viruses that can affect donkeys, and then they isolated that one from the gazelle and zebras. So
wow,
you got several more going on. But again, that's just kind of fun facts. But for us, the gamma herpes virus, you're looking at type 2 and type 5. And that is a huge debate. Type 2, you think of keratoconjunctivitis. Type 5, some respiratory issues. But type 2, you can start thinking of the eyes. You see, as I said, conjunctivitis. In type 5, you see some just vague respiratory signs. It depends who you end up talking to, because I have people that here in Kentucky that swear type 2 and type 5 can cause respiratory disease in foals, especially unweaned foals or just recently weaned foals. And we've seen that by themselves, causing some fever, some upper airway disease, some lymphadenopathy with a type 2 and 5. I'm talking about younger animals right now. We'll get to type 5 later for the older animals. But right now, and so the debate is, do they cause primary disease, or are they like another herpes virus we talk about? This is a human equine herpes virus 4, Epstein-Barr, mononucleosis. Everything's Epstein-Barr, getting mono. You get lethargic as a human. Now, I've had mono. I was lethargic during my internship. I was lethargic, fevers. I don't know what the heck hit me. I thought I got exposed to salmonella from an animal I was treating. I was in Arizona. I went to the Mayo Clinic, went to the infectious disease specialist. I just called myself in. I said, this is Dr. Slovis, referring myself in, and I got right to him. Because I don't know, did I have TB? I don't know what the heck I had. The time I was down and out having 105 fevers for 3 days, and I thought I better check myself in. Well, it turned out, lo and behold, just mono. But that can be immunosuppressive. So do these viruses, which you can find in almost, if you search for equine herpes virus 2 and 5 in a young animal, you'll find it, 90% of the time. But do they cause immunosuppressive aspects, like you think about Epstein-Barr in humans, and predispose them for other infections? And that was a big thing, that a lot of these animals that have EHV 2 and 5, you find that were sick, they also had secondary infections like strep zoo, pneumonia, or other issues these foals may have. And then after, all of a sudden, you clear them of their pneumonia, and they do fine for a week, and then they get another disease. They get another, now I got actinobacillus pneumonia. And they're like, what the heck's going on? These animals are immunocompromised. And so what you tend to do is get them outside, get them out of the stall, because it's so dusty. And to just all the different antigens they're exposed to in the stall, they develop so much mucus. They got hyper-responsive airways. And it just sets them up for infection after infection after infection. And we've investigated this with Gluck and with a bunch of other people. And we still don't have answers of why. These animals get recurrent infections. But all you keep, you do tend to see type 2 or type 5, or usually both of them together. And is that a perfect storm for immunosuppression? I don't know. More studies need to come out that smarter people than I. But we tend to see them here. But usually there's a co-infection. I've yet to see them by themselves. But I know some of my colleagues here that they swear up and down, yes, that they have. So Lutz at Gluck is helping us out with that, where we're sending them samples and trying to understand these gamma herpes viruses a little more. And another group in Europe is looking at it. So there's a lot of some debate on there. But the interesting thing is, in one talk I was listening to, that EHV2 is higher in Icelandic ponies than and can you believe that? There are higher incidence in Icelandic ponies, even though they're free of EHV1. And most of the foals are less than 10 days of age when they start looking for it.
Wow.
So, it's out there. And foals are exposed early in life to this within days.
Yeah.
And they'll find in the trigeminal nerve, they're finding the submandibular lymph nodes, they're finding lymphocytes. But the big thing is that we have a concern, and that's foals. But for adults, EHV5, you think of, multinodular fibrosis pulmonary aspect in adult horses, and that's just a very fatal disease. And the problem with these gamma herpes viruses is just find a good antiviral. There's debates as valcyclovir doesn't work. That's a potent antiviral in our hands. But yet we still use it because it feels like we're doing something for these pulmonary nodular fibrosis. We put them on corticosteroids, reduce any inflammation that's occurring because of these viruses. That may be predisposing to then, get fibrosis of their lungs. But that's when we started thinking about adults is EHV5. And what do I treat these animals with is corticosteroids, valcyclovir, bronchodilators if we have to, some expectorants if we need to, and just tincture of time. And we've done some miracles out, on animals that were pregnant with high dose of corticosteroids.
Wow.
On these animals and try to get them done. And they're on a course of that for several months.
Wow.
If you have a chance for survival, it just depends on the degree.
Yeah.
And just because you can find EHV5 in an adult horse doesn't mean they're going to get pulmonary fibrosis. Because I said, a lot of it, you can find it. If you look for it, you can find it. But there's something else that triggers it. And what is it? I don't know.
Okay. And we have to mention this, although before we started this podcast, I have to say that I asked Dr. Slovis if we really should even mention, some of this other stuff. But, you very rarely see these, right?
Yeah. Type equine pulmonary multinodular fibrosis. And I got a biased group. I'll see 2 or 3 a year, or my colleagues and myself. But yeah, it isn't that common in adult horses. It's out there, but it's not a common entity in your practice. Another one we won't see a lot of, at least here, is EHV3, choroidal exanthema. So you get those lesions, ulcerative lesions of the vulva or the penis of a stallion. We're lucky we don't see it here. A lot of it is hygiene. Look how they're preparing these mares and the stallions for breeding. So I've been lucky. I've not seen many of that. And, I've been in Kentucky for almost 25 years. And I don't see it. I've seen it more when I've been called out to investigate infectious diseases, in Europe. And, a lot of it comes down to hygiene. Look how they're preparing the mare and how they're contaminating their equipment. And that's a big thing. So it's usually, humans have a big factor of this too on the big breeding farms.
Well, I certainly do appreciate you joining us today to just walk us through kind of this review of herpes virus. And I know this is things that there's books written on this, but it was really nice to pick your brain a little bit today, Dr. Slovis. So thank you very much. And we also want to thank our audience for listening to us today, and a special thanks to our 2023 sponsor, Merck Animal Health, who gives us the opportunity to have these discussions. And if you have any questions or suggestions for the podcast, send an email to me at kbrown, that's the letter K Brown, at equinenetwork.com.